Worsening heart failure is both common and predictive of poor outcomes. You might think, well, yeah. Well, the issue is it really is more complicated than that. And the importance of worsening heart failure in ambulatory patients is the title. We're talking about a JACC heart failure paper from the September 2016 issue. And to do so, I'm talking with Dr. James Januzzi, who is an MD and the Hutter Family Professor of Medicine at Harvard Medical School. First, thank you for going through this yet another time with me.
Yep, not a problem.
What I wanted to do is, while you might think this paper is defining the obvious, the editorial comment that really was tied to this paper emphasized it's really not that easy. And what I have to say to you is it really isn't, correct?
That's correct. So the issue with worsening heart failure in ambulatory patients is that it's a very poorly defined syndrome, if you will. There's been a lot of focus on worsening heart failure in hospitalized patients. Indeed, that's the focus of clinical trials now. Sure. But in the office, it's gone largely unrecognized as a major issue. And while the practicing clinician might say, well, we know this.
It's inevitable.
It's inevitable. If a patient starts to decline, you know that they're in trouble. But it's never really been quantified just how risky this syndrome is. And indeed, we showed that the risk for subsequent hospitalization within a 30 to 60-day follow-up window was astronomically high, along with a similarly high risk for death. So it not only quantifies the syndrome, but the other thing we added was we defined criteria for not only clinicians to use, but also for clinical trials to subsequently study prospectively strategies to prevent worsening heart failure in the office.
So what gave you the idea to do this?
I'm a clinician. It's one of those things where I talk to my patients, I listen to what they say to me, and I see in the course of their care that this is more than just a little adjustment in diuretic and they'll be fine. Not infrequently we see patients getting into this downward spiral of increasing congestion, worsening symptoms, ultimately culminating in hospitalization. The other thing that we studied in this analysis was the effect of aggressive heart failure management strategies, because one question is there anything we can do to prevent worsening heart failure? See, if we accept that worsening heart failure is a risk for hospitalization, rather than being reactive to it, we should try to be proactive and prevent it. And indeed, in this study, this was a comparison of two groups of patients managed with different strategies. One was a biomarker-guided heart failure strategy, aggressive titration versus usual care. And what we showed was that biomarker-guided heart failure management reduced the risk for worsening heart failure by 50%.
Wow. Now, I do think we need to specifically describe how you and your co-authors defined worsening heart failure.
Yeah, thanks, Rick. So again, as I said, there was no prior definition for it, and indeed some of the trials for worsening heart failure actually just leave it up to the physician at the bedside to say, yeah, that's worsening heart failure. You know, trying to look at it from a scientific perspective, we defined it using symptoms, signs, so symptoms from the patient, findings on physical examination, as well as the need for unplanned intensification of diuretic therapy, right? So it's a mixture of clinical variables as well as physician response. And if a patient had 2 out of the 3, they basically qualified for the diagnosis of worsening heart failure.
And so Barry Greenberg wrote the accompanying commentary, and he wrote, worsening heart failure in ambulatory patients is associated with a subsequent increase in events, and although perhaps intuitive, it is an important observation that indicates the need for enhanced follow-up surveillance and adjustment of therapies in order to prevent those future events.
Yep, Dr. Greenberg is right on target, I think. The issue here is it's something that we as clinicians know occurs, but the problem is, what do we do about it? And as I said, I think that this really draws focus on this relatively unstudied issue that could be very well a target for clinical trials in heart failure. We know in heart failure trials that we're doing a better and better job of reducing cardiovascular death, reducing heart failure hospitalization. So one question is, what else can we do to improve the quality of care of our patients, the quality of life of our patients, and ultimately avoid the subsequent hospitalizations they may suffer?
So are you doing anything different now that you wrote the paper?
Sure. Well, it's a really important question. So now that we've defined the terms, at least on a clinical level, it's something that's been on my radar for quite a while. It's why we did the study in the first place. But we are designing actually clinical trials to look at this question, in particular focusing on newer heart failure therapeutics, sacubitril, valsartan, and Entresto. We're looking at its effects on worsening heart failure in the office. So I think the future is bright in terms of our ability to build strategies to help reduce the risk. Indeed, we know that in the PROTECT study, this biomarker-guided trial, that it is possible to reduce the incidence of worsening heart failure using a heart failure strategy of aggressive care. So how one decides to deploy that care at the first sign of worsening heart failure, for example, or using the variables we identified to predict worsening heart failure before it even happens, might be a way to improve care for patients.
So for right now, is there a clinical message you'd like to give us?
Sure. I think that for the clinicians among us, it's important to recognize that if a patient develops signs and symptoms of worsening heart failure, even if they improve after a simple titration of diuretic therapy, their risk for consequent hospitalization or death, importantly, is substantial. And so this is not just a little bump in the road. It is a big warning sign that worse things are to come unless care is really intensified in a guideline-directed manner.
Well, Dr. Januzzi's paper is available for you. It is in the September 2016 issue of JACC Heart Failure. And for CardioSource World News, I'm Executive Editor Rick McGuire.